presentation and get introduction started.
Recording is started.
All right, good afternoon, everyone. You are in the webinar for the Supplemental NOFO to address unsheltered and rural homelessness with the Texas Homeless Network. We're glad you're here. This is an amazing opportunity that we're really excited to talk more about. If you're not muted, please make sure that you mute yourself if you're just joining us. My name is Jim Ward. I'm the Director of Planning. I'm joined by Mary Stockey, the Director of Engagement. We have a few housekeeping items that we wanted to talk through. And before we really kind of jump into the meat of the content of this presentation, I think we need to acknowledge up front that this is going to be a lot of content. We're going to do the best we can to make it manageable in terms of speed and the volume of content. We're going to take a break at the top of the hour just to let folks kind of digest what we talk about in the first half of this presentation. But if you need anything, if you're having trouble hearing on the audio, if you have questions, any of that stuff, drop it into the chat, and there's staff monitoring the chat, so we'll be sure to address your question if we're able to. If not, we'll sort that out. I just want to make sure everyone can still see the presentation. Okay, great. Mary, I'm not sure if you wanted to introduce yourself or say anything else before we kind of get started.
Yeah, thanks, Jim. As Jim said, I'm Mary Stockey, the Director of Engagement for the Texas Balance of State CoC. And we are going to talk about a lot of information today, but I want to reemphasize that this is such a historic opportunity and amount of funding that's really never been available to targeted to address unsheltered homelessness and rural homelessness. So we're really excited about the opportunity. We understand that HUD had planned to release this NOFO some time ago, like maybe in 2020 before COVID hit, but it got delayed because of COVID. And so we weren't exactly expecting it at this moment, but we're glad to have it. And we have a set amount of time that we're going to put together a plan and help you apply for the funding. So I guess buckle up, and we'll be talking through a lot of it today. But as Jim said, put your questions in the chat, and we'll answer as many of those as we can today. We will also be creating a frequently asked questions, or FAQ document with questions and answers. And we will be having a couple more input sessions specifically for the plan. So we'll tell you all more about that as we go along. But we're so glad you're here. All right, so we'll jump right in to the opportunity. It has a very long name, the 2022 Continuum of Care, or CoC, Supplemental Notice of Funding Opportunity, or NOFO, to address unsheltered and rural homelessness. So if you're able to download the slides, everything that's green and underlined is a hyperlink that should take you to a document. We do also have this NOFO in the materials pod. It is item number 2, as well as the 2 appendices to the NOFO. Appendix A, which lists the dollar amounts available, and Appendix B, which is a list of the counties that are identified as rural for this supplemental NOFO. So we will be calling it the supplemental NOFO. It's a very long name, but we'll call it the supplemental NOFO. And it is about $322 million available across the country to assist communities, again, with addressing unsheltered and rural homelessness. We heard on a HUD webinar that they are looking for what they call game-changing efforts. and that they want to support CoCs in our efforts to turn the tide on unsheltered homelessness across the country. So that is really the big purpose of this funding. So let's move to the next slide, and I'll briefly tell you about the agenda. Again, we're going to talk about the purpose of the NOFO and HUD's policy priorities for it. Then we'll compare and contrast this supplemental NOFO with the annual CoC program NOFO in competition, the one that you might be more familiar with that we go through annually for CoC program funds. Then we'll talk specifically about a CoC plan to address severe service needs. That is a component of the application that we would submit to HUD. We're going to talk about the competitive application process, or how a project can apply for funding. And last, we're going to talk a little bit about resources. And thank you, Craig, for putting the acronyms in our chat. TXBOS-COC is Texas Balance of State Continuum of Care. Let me go a little bit into that at this moment. We are the lead support agency to help all the CoC members in our geographic area, which is about 215 counties, to coordinate and plan and deliver homeless services. And so it's called a balance of state continuum of care because we're all the counties that don't belong to a different continuum of care in the state. And we have 11 in total. So we cover a big area. Much of it is rural. And so I know this opportunity will be, y'all are eager to hear more about it. So from HUD's press release, I took a couple of quotes because I thought they captured what HUD's intent is. So this initiative for unsheltered and rural homelessness strongly promotes partnerships with healthcare organizations, public housing authorities, and mainstream housing providers, and people with lived experience and expertise of homelessness. So this NOFO is all about partnerships with housing, healthcare, and people with lived experience of homelessness themselves. It will fund outreach, permanent housing, supportive services, and some other costs as part of a comprehensive community approach to solve unsheltered homelessness. So that theme will also be coming up again and again about a comprehensive community-wide approach. And again, there is what they call a set-aside of $54.5 million specifically for rural communities. So we put the link to the press release there if you want to read more about it. So again, just kind of more setting the stage for where this NOFO is coming from and what the intent is. National Alliance to End Homelessness, which is a national organization that helps communities prevent and end homelessness across the country. They posted a blog post that gave some context. So for one point is that in the 2022 point in time count, or PIT count, that annual count that all CoCs are required to do, it showed more unsheltered single individuals experiencing homelessness than people who are sheltered. And that was the first time ever in the time that HUD has been collecting point-in-time count data, and we've been submitting point-in-time count data, and all of you have been doing the point-in-time count, that there were more unsheltered single individuals counted than sheltered. So it is a growing problem across our country. If you read, almost any media source talks about homelessness in some way because there are so many people going through it, and we want to find ways that we can reduce that. And so that's what this money is all about. And National Alliance says, despite overwhelming public pressure and the dedicated efforts of the homeless service sector, communities lack the scale of housing and service resources to meet the needs. And so that is, again, why one of the reasons that this money has been made available. Also, NAEH talks about a growing public concern about unsheltered homelessness because it's a very visible form of homelessness. And so as communities are looking to respond, HUD wanted to make money available to respond in positive ways, like creating permanent housing and supportive services and more outreach connected with housing and healthcare, rather than doing things like criminalizing homelessness, like arresting people for sleeping outside or something. And again, this is an essential opportunity to reverse that course of punitive tactics and to really pay for the kinds of things that have shown, research has shown, do reduce the number of people who are experiencing unsheltered homelessness. So their approach that they're recommending is to be urgent but equitable, help people who are facing the greatest needs, adhere to housing first principles and practices, and incorporate needed services by collaborating closely with partners. All of those bullet points might sound really familiar to you. It's very similar to the HUD CoC program and other best practices that are out there in homeless services. And then finally, from the NOFO itself, purpose of this special NOFO is to target efforts to reduce unsheltered homelessness and homelessness in rural areas. HUD will award funding to communities to implement coordinated approaches that are grounded in housing first and public health principles to reduce the prevalence of unsheltered homelessness and improve services engagement, health outcomes, and housing stability among highly vulnerable unsheltered individuals and families. So I think that last paragraph is, actually it's on the next slide, Craig. HUD will award funding to communities to implement coordinated approaches, and all of that rest of that paragraph is what this NOFO is about in a nutshell. All right, and the next slide, we have HUD policy priorities for the NOFO. So again, what are we aiming for? Reducing unsheltered homelessness. In rural homelessness, we want to reduce homelessness among individuals and experiencing unsheltered homelessness and those with severe service needs. Provide assistance on tribal lands. Involve a broad array of stakeholders in the CoC's efforts to reduce homelessness. And those stakeholders include persons with lived experience of homelessness. Advance equity and use a housing first approach. All right, then on the next slide, the National Alliance to End Homelessness described what those policy priorities mean in a little bit of more detail. And I'm not going to read through that, but we wanted you to have it in the slide so you can get a little more detail about what each of those policy priorities are that HUD is aiming to accomplish. And therefore, our CoC and your projects that apply for this funding would be also prioritizing. And we'll talk more about eligible activities later in the presentation. All right, next slide. We know, again, this is a lot of information. We want to just do a check-in right now. If you could put in the chat how our presentation speed is going so far. If you think it's going too slow and you want us to speed up, give us a 1. Just right is a 3. Too fast, please slow down is a 5. Great, I see lots of 3s. And a 2, okay. So maybe a little bit slower. Okay, 3, but would like the slide deck to follow. Okay, so, okay, I will do a better job of making sure I ask someone to advance the slides. So thank you all for that feedback. And Jim, I will turn it over to you.
Thanks, Mary. So again, hello everyone. My name is Jim Ward. I'm the Director of Planning here at THN. And we wanted to talk a little bit about kind of basic information about the Supplemental NOFO, I just want to acknowledge you may hear my child screaming in the background. He's 2.5 and is refusing his naps now, so that's great. But I apologize. I may need to go on mute occasionally if it gets too loud. Yeah, so the amount made available under the Supplemental NOFO is about $50 million under what they call the Unsheltered Set-Aside. The Unsheltered Set-Aside, and we're going to talk a little bit more about this because it gets pretty confusing, is intended to, again, as Mary previously spoke about, meet the needs of individuals and families with the most severe service needs. And then additionally, they made available about $17 million, $17.3 million for this rural set aside. And as some people have already kind of acknowledged in the chat, in Appendix B in today's materials pod, you can find a comprehensive list of the counties that HUD has defined as rural under this NOFO. So they are not using the same definition that you may be familiar with. They established their own definition for the purposes of this NOFO and supplied that list of eligible counties with the release of the notice. So it is possible that there might be errors in there. If you believe that you're in a county or have a concern about a county that is not represented on that list, we can definitely help you explore that and submit questions to HUD to determine whether or not that is in fact an error. But in any event, there's about $17.3 million set aside for this rural housing infrastructure building that needs to happen. And so something else that is important to understand, but that if you're familiar with the Continuum of Care program, is that the annual competition, which funds renewal, permanent, supportive, and rapid rehousing projects in the balance of state, that annual competition has yet to be announced by HUD. However, we know is that we're anticipating for it to be significantly less amount available than even the unsheltered or the rural set aside alone. And so the other thing that's really important to understand about this opportunity is that this is for new projects only. So renewal projects are not eligible for funding under the Supplemental NOFO. We do believe and are anticipating the release of the annual notice of funding opportunity imminently. They will not give us a day, obviously, but we are anticipating it any day now. And so that annual funding opportunity will be the place for renewal projects and kind of the more traditional CoC bonus and DV bonus type projects or domestic violence bonus projects to apply. Similar to the annual competition, the project applications that are submitted by direct service providers must be submitted to the Continuum of Care or to THN, and then THN will include those applications following our assessment with the CoC's priority listing and will be submitted with the CoC's consolidated application. Something else that's really kind of unique about this opportunity is the grant terms. So 3-year grant terms. So normally with the Continuum of Care program, a project that's awarded under a new bonus type initiative would be awarded for a 1-year grant term, and then that project would be renewed on an annual basis. And this opportunity, HUD is saying, no, we're going to level up for 3 years on the front end. And we'll talk a little bit more about the renewal process. But basically, the short of it is we don't know what the renewal process will look like at this point. However, HUD has stated in multiple venues that there will be some mechanism for renewal for these projects awarded under the Unsheltered and Rural set-asides. And then as Mary kind of alluded to, all of this is happening really, really fast. The applications, the CoC's consolidated application is due to HUD on October the 20th, 2022. We're not going to get deep into the competition timelines during this presentation, but there are a variety of other deadlines within the notice of funding opportunity that will require us to carry out certain activities following the completion of the CoC plan. So if you're kind of planning your vacation, be looking at the month of August and September and going into early October to be really, really busy. I think the headline here is that, as Mary has already said, this is a historic opportunity and is similar to, but very different from the annual competition in a lot of ways. And we're going to kind of talk in more detail about the similarities and the differences there. So I'm going to move us on to the next slide. Sorry, y'all. I'm trying to do too many things at once. So the amounts available to the continuum of care are based on what HUD calls the PPRN, or Preliminary Pro Rata Need Formula. And that amount that is listed on the prior slide is actually a 3-year amount. And so when you're thinking about the total amount available to the continuum of care on an annualized basis, you basically want to take that total number and take it down to a third of that, which is about 16 million and some change annually. Still a significant amount of money that has never before been made available. I'd already kind of mentioned that applications are selected through a local application process, very similar to the annual CoC program competition. And the mechanism that they'll use to award the funding available and CoC program matching requirements all apply, as well as the certification of consistency with the consolidated plan. As always, HUD retains the discretion to approve or deny any project application that fails to meet their threshold review. So it is possible that THN would approve a project application and it gets to HUD, and then HUD ultimately ends up rejecting that project or declining to fund it because they've run out of funding. So we kind of talked a little bit about the annual competition. There's 3 main parts to this notice of funding opportunity for project applicants: the CoC application, the priority listing, and the project applications. In general, HUD will fund many of the same activities eligible under the CoC program, but there are some notable exceptions and additional flexibilities under parts of the Supplemental NOFO. And we're gonna, as I feel like we've said now a couple of times, that there's going to be a ton of content in this presentation. So we'll dive more into the flexibilities that exist under the Supplemental NOFO later in the presentation, probably after our break at 2. But just, the types of things that HUD is looking to fund are things like rapid rehousing. So rapid rehousing is a time-limited intervention. It's typically it's rental assistance less than 24 months. That rental assistance is coupled with supportive services. Generally, we're talking about things like holistic case management, childcare, employment, workforce development type activities, adult education, food, transportation. Those types of activities are all kind of rolled in with that rental assistance, and to make a project that's priority and goal is to move people from homelessness to stable housing and to permanency at the end of that assistance. So, folks are really working on a continuum to get people to where they can thrive without the need for assistance from the project. Additionally, permanent supportive housing is very similar to rapid rehousing in that the supportive services are coupled with the rental assistance. The notable exception there is that there is no time limit for the amount of time that someone can participate in that type of project. Additionally, the joint transitional housing and rapid rehousing component project is a mouthful by itself, but it combines or seeks to combine both transitional housing and rapid rehousing into a single project that centers client choice in the placement of the participants that are enrolled into that project. So at any time, someone enrolled in a joint transitional housing and rapid rehousing project should have the power of client choice and autonomy to determine whether they want to participate in the transitional housing or the rapid rehousing part of that project. In addition to funding those kinds of permanent housing activities, HUD will fund HMIS. So HMIS is less relevant for project applicants In order to be eligible to apply for an HMIS grant, you must be designated by the CoC to administer the HMIS grant. However, HMIS as a component is eligible under all of the other categories of project, but HUD is funding new HMIS to support the activities in the supplemental NOFO. And then finally, is kind of biggest departure from what we've seen over the last several years is the SSO, or supportive services only. So supportive services only are things, it's kind of what it sounds like, right? Think things like street outreach. There are different types of supportive services only projects. The primary intervention there that we see, though, is street outreach. And HUD has not funded street outreach for at least 6 years. They've never funded it in the time that I've been at THN. But this is an opportunity for communities to fund street outreach. Typically, those types of activities can be funded under other federal programs like the Emergency Solutions Grant Program. But in this instance, they're eligible for funding under the Continuum of Care program. And THN staff, just kind of stop me if there's stuff in the chat that I need to take a break on and address.
No, you're good so far.
Okay. So in contrast to the annual competition, the supplemental and annual competitions are going to run on different timelines, but at some point or another, they will run concurrently with one another. It's going to make things super confusing for everyone involved, including THN staff. In order to try to keep this as streamlined as possible, we were hoping initially to run all of this through one application process and through one request for proposals. It is not feasible for us to put all of this content into a single request for proposals. So there will be 2 RFPs likely released within weeks of one another. And I mentioned previously, HUD has stated their intent to renew these projects, but the mechanism for renewal is unclear. And so projects awarded under this supplemental NOFO will be in operation for a minimum of 3 years.
Jim, we got a question. So if the application is doing rapid rehousing and SSO, would you need to do 2 separate or joint application?
That's a great question. So I want to hold those application specific questions until we get to that part of the presentation, but the short answer is it depends. So not a super clear answer from me, John, but I think there's a way to do it where you tie it to the project. There's also a way to do it where you tie it to the community. So we can talk more about that here in a little bit. So someone asked a question in the chat earlier. So these funds are only eligible, I think, to the rural counties. And for the rural set aside, that is accurate. The supplemental competition will fund activities under both the unsheltered and rural set aside. The entire 215 county area of the balance of state is eligible for the unsheltered set aside. However, the rural set aside is only available to those communities in Appendix B. We haven't really talked a ton about the annual competition, but before we get into that, I just want to kind of acknowledge that not all of the activities funded under the supplemental NOFO are eligible under the annual competition, and not all of the activities eligible under the rural set aside are eligible under the unsheltered set aside. I know that's tough to wrap. It's been tough for me to wrap my mind around. It just kind of highlights, I think, the complexity of the opportunities that HUD is putting out at this point. And we will likely have to restrict different activities to different opportunities. Obviously, if something's not eligible under one opportunity that an applicant applies for, we're not going to be able to fund it. But similarly, we may place additional restrictions on activities within eligible opportunities. One of the biggest things for applicants to understand is that in the annual competition in 2021, HUD awarded what they called bonus points for applicants that were able to demonstrate that they were leveraging healthcare or housing resources. This year, leveraging housing and healthcare resources is a threshold eligibility criteria for the CoC. It is critical to the CoC's success in this process. And so we are really going to be looking for project applications that can demonstrate the ability to leverage other resources that exist. If you're hearing all this right now and freaking out, don't do that. We're going to have plenty of opportunity to talk more about what that could look like. But the idea is really that we are, in order for us to get any funding under this opportunity, we're going to have to be able to leverage housing and healthcare resources. And so we're going to talk a little bit more about what types of housing and healthcare resources are eligible to demonstrate that leveraging, but it's pretty broad. So we can talk more about that in a little while. And then finally, the supplemental and annual competitions require a CoC application. I referenced that a moment ago. That CoC application is something that THN completes on behalf of the continuum of care. However, only the supplemental NOFO or supplemental competition will require this comprehensive plan to address or to serve individuals and families experiencing homelessness with severe service needs as a component of the CoC application. So even though that plan, that comprehensive plan or the CoC plan is not a part of the annual competitive application process, we are anticipating that HUD will ask CoCs to incorporate that in some way for new project applications funded or requested under the annual competitive application. And so I know that this idea of this CoC plan, like folks are probably thinking, what is that going to look like? And we are going to talk a lot more about that. The next few slides are dedicated to the CoC plan. And for that, I'll turn it back over to Mary.
All right. We'll just take a little moment for a breath here. So you've heard a little bit of overview of the plan and how it is similar to and different from the annual CoC program competition. And now we're going to move into the piece that Jim mentioned, which is short name called CoC Plan. So if you will go to the next slide, please. All right. So part of that full application that we'll send to HUD on behalf of our CoC is that we must develop what they're calling a comprehensive CoC plan to serve individuals and families experiencing homelessness with severe service needs. So that's the full name of the plan. Again, we're shortening it to CoC Plan in this competition. And you'll find all the information for that plan in the NOFO in section 7B4, which is on pages 46 to 53. Overall, the plan just describes our CoC strategy for reducing unsheltered homelessness. We don't have a plan right now that's specific to reducing unsheltered homelessness. But again, in order to take advantage of this opportunity and in order to address the growing need for helping people get out of unsheltered situations, we are going to work really hard over the next few months to create a plan and have all of you apply for funding that with projects that align with the plan. So in order to apply, you must demonstrate in your project application how your project is consistent with the CoC plan. So we at THN, as the support staff for the CoC, will be drafting the plan, but today we'll be giving you an opportunity for input into the plan, and we'll talk later about a few more opportunities to give input into the plan. so that as we're drafting it, we are already incorporating what all of you say needs to be in the plan. And then once a draft is available, you will again have an opportunity to review it and give your comments. So we want it to really reflect what CoC members know needs to be in the plan. We are going to incorporate it into our current CoC strategic plan under goals 1, 2, and 5 about increasing housing and access to housing and increasing funding in the CoC. Again, HUD says that for this plan, they really don't want to just see how we might spend the money. They want to see a plan that shows that we're adopting best practices, we're being innovative, and we're targeting unsheltered people with housing first guided housing and services. Yeah, so getting into the actual sections of the plan, the first two are similar, so I put them on the same slide. And they are about how the CoC will leverage housing resources and how the CoC will leverage healthcare resources. So again, what they want to see in our CoC's plan is how will we use housing resources above and beyond what this NOFO offers. And we're looking at developing new units and creating new housing opportunities. So maybe not a new unit, but maybe, as the next one says, landlord recruitment to get more current units that are available in your community to be focused on sheltering people who are unhoused and in unsheltered locations right now. And then similar for healthcare resources, how is our plan, overall plan, and then how is each project that is applying for this funding going to incorporate healthcare resources as part of their project. So HUD will be looking for letters of commitment or memorandums of understanding between the CoC or your project and housing resources that show the number of units that will be supported, the dollar value of that commitment, the dates that those units are available. Jim will get more into that, but that's kind of the high level of, again, bringing more resources to the project in addition to the money that you're applying for through this NOFO. And same with healthcare resources. And that will be through a formal written agreement with a value of commitment. And so want to make sure that we are incorporating those two other arenas very clearly into these projects and this plan. All right, next slide. HUD is also wanting us to talk about what is our current CoC strategy to identify, shelter, and house people experiencing unsheltered homelessness. So specifically, they ask questions about what is our current street outreach strategy? What is our current strategy to provide immediate access to low barrier shelter and temporary housing? And what is our current strategy to provide immediate access to low barrier permanent housing? So again, looking at a housing first approach, a low barrier approach. And so HUD is not only looking at our current strategy, but CoCs can also earn points by talking about what they will do to identify, shelter, and house people using these different strategies. So I want to make sure that you know, even if we don't have something in place right now in your community or CoC-wide, that doesn't mean that we won't be earning any points in our CoC application and in our CoC plan. The next section of the plan, this lists the final pieces of it, looking at how might we, again, update our strategy to identify, shelter, and house people experiencing unsheltered homelessness. So not only what are we currently doing, but what do we identify that we could be doing better? So again, we want to know already what's happening in your community, and then what you envision through your project application or yours and other project applications from your community that would not only update but strengthen your strategies. Clearly, we're looking at identifying and prioritizing households experiencing unsheltered homelessness or with histories of unsheltered homelessness. That points to one thing about this NOFO is for permanent supportive housing, or PSH. It is not limited to a certain subpopulation, like people who meet the definition of chronically homeless. So prioritization through coordinated entry is going to be really important to make sure that this particular pool of funding and these projects are being offered to people who are currently experiencing unsheltered homelessness or have histories of unsheltered homelessness. You heard us say a few times already, an important piece of this is involving people with lived experience of homelessness and decision making. So we are going to talk about what we have in place already, again, on the CoC level and on the local level, and what we plan to enhance as part of this CoC plan. And then finally, supporting underserved communities and supporting equitable community development that is offering equitable housing interventions. So HUD defines underserved communities, and I think we do that later in our poll question, so I'll save that. But it's really looking at trying to reach people in our communities that are experiencing unsheltered homelessness that we may not be reaching already, and making sure that we are paying particular attention to those populations that are overrepresented and need an equitable opportunity for housing interventions. So again, that's a lot, but that is the content of the plan. And again, I'll just repeat that we as staff at THN are going to be drafting it with input from CoC members, and we will be making the draft available for public comment and input. So you will have some opportunities to get in on the ground today, the very first opportunity, and several times over the next couple months. All right, let's go to the next slide. Just a quick note that the CoC plan itself that we just talked about with those 7 sections is scored differently depending on whether the CoC has applications for the unsheltered set-aside funds or the rural set-aside funds. So for the unsheltered set-aside, the CoC plan is worth up to 70 points out of a total of 100 points possible for the entire application. But for the rural set-aside, the CoC plan is worth only up to 59 points. And the total possible points for the rural set-aside is 89 instead of 100. So if you see that kind of language in the NOFO, that's what it means. And that's because there are a couple of questions that are asked for unsheltered set-aside that HUD is not going to consider in the scoring for the rural set-aside funds. So they've removed those questions, in essence, from the scoring for the rural set-aside. All right. So this plan is to address people experiencing unsheltered homelessness with severe service needs. So what does HUD mean by severe service needs? Well, there are 6 different descriptions here. So it's people who are facing significant challenges or functional impairments, regardless of their type of disability, which require a significant level of support in order to maintain permanent housing. And a clarification from HUD is that this factor focuses on the level of support needed, and it is not based on the disability type. So again, we're looking at people who are going to need a significant level of support to stay in their permanent housing. Another severe service need is maybe someone who has a history of high utilization of crisis or emergency services to meet basic needs. And those include things like emergency rooms, jails, and psychiatric facilities. Third severe service need is maybe someone currently living in an unsheltered situation or having a history of living in an unsheltered situation. Someone who's experiencing a vulnerability to illness or death. Someone who has a risk of continued or repeated homelessness. You'll see some of this is similar to the chronically homeless definition. And then finally, having a vulnerability to victimization, including physical assault, trafficking, or sex work. So as we're creating this plan to help people with severe service needs, these are some of the kinds of situations that people might have been coming from. So again, emphasizing that focus on, for this pool of funding, on folks who are needing the services the most. And I'm just going to take a breath there before we go into the next slide. Certainly, if you have any questions, again, put them in the chat. And we will be having poll questions and a Q&A time for this section. So you can also ask your questions then. All right, so again, HUD wants to see a lot of participation from all kinds of stakeholders in the community. We have to do what's called participative planning and implementation. So we're going to talk about the steps we'll take to ensure that traditionally marginalized populations, such as racial and ethnic minorities and persons with disabilities, will be able to also meaningfully participate in this planning process. So we'll be doing some targeted outreach, and we'd love for you to do that in your community as well, and bring folks from those groups either to the webinar input sessions or have them complete the survey to give input. And then with CoC coordination and engagement, HUD is looking at how we, as a CoC and as project, are coordinating with other systems of care and with funding other than CoC program funding. And again, we have an inclusive community process for developing and implementing the strategy or the plan. So lots of repeated notes about coordinating. All right. Next slide, please. There are some letters of commitment that are required, specific to, again, that first part of the plan about new housing units and new housing opportunities. So again, how are we partnering the projects that we're applying for in this NOFO with new housing units and housing opportunities? And we'll need letters of commitment for that. And how are we partnering with healthcare resources? There are also is a section where persons with lived experience and expertise of homelessness that the CoC has as a working group will need to sign a letter of commitment that they approve the priorities that are in the CoC plan. So you'll see in the timeline in just a moment, once we've drafted the plan and gotten more input on the draft, we will be working with our Persons with Lived Experience committee to review it with us and give us their input and their signature of approval before we even take it to the CoC board for their approval. And that committee, very fortunately for us, is planning its first meeting for early August. And we've been working on that for about a year to try to pull together So we're excited that we are almost there with that committee. And then finally, letters of commitment from the Public Housing Authority, in our case, authorities across our CoC, for how they are going to participate with us in these projects. All right, again, I've mentioned some of this before. If you'll go to the next slide, how will this process work? We're going to get some feedback with you today. We will have some ongoing feedback, maybe through our PC is public comment portal, maybe through something simpler like just a survey, an online survey that you can fill out, and we can spread far and wide and try to get as many people in the CoC to answer. We will be having a few more input sessions. Staff will draft the plan, persons with lived experience committee will approve the plan, and then it will go to the board for approval. And really what we want to hear is, what are the most important points to include in our CoC's plan? All right, let's go to the next slide and talk about the timeline. So you'll see today is our start, July 13th. We're gathering input from you at this webinar. I said July, but now we think it's going to be early August based on the schedules of the committee members. Persons with lived experience committee will give us their input. Then by the 29th, we plan to post a draft plan on the website. We'll have another focus group on August 3rd to hear more input and feedback on the draft. We're going to also have a session like that during our regularly scheduled CoC general membership meeting on August 10th. And then present the plan to persons with lived experience committee for their approval of the final plan in like mid-August, and to the board for their approval in later August. And then if that is approved, shortly after that is when we will release the final plan and the request for proposals, because we know that you need to see the plan in order to be able to design your project application to align with the plan. But we don't want to surprise you, so we want you to tell us what needs to be in the plan. And I say it looks like maybe some people are already giving us input.
Yeah. Jim, there's a couple questions in the chat pod that you could probably answer.
Yeah, thanks, Craig. So I see one question from Doris Jones. Does this opportunity cover capital costs, i.e. construction, property purchase, and renovation? Capital costs, just like as you've described there, are not eligible under the unsheltered set aside. There is a possibility that the board would approve to allow those costs under the rural set aside, but not HUD prohibits them under the unsheltered set aside, which is definitely where the larger pool of funds are. And then the second question that I see here, how would these two categories be supported by? So youth aging out of foster care. I'll tell you what, let's move us into the poll questions, and let me chew on this question for a second, and then we'll keep going that way, if that's all right with folks. I'm going to move us over to the poll questions, Craig, or thank you. And I'm not sure, Mary, if you want to start with the poll questions.
Yes, thank you. So we try to make these poll questions pretty easy to answer, where you'll either choose every option that applies or answer a yes/no question. We will be getting some more in-depth feedback through our online survey, but for this meeting, we thought it would be easiest actually to just have you answer some basic questions, and then we can follow up with you about details. So for example, the first one is, which of the following housing resources do you think you might be able to leverage for your proposed rapid rehousing or permanent supportive housing project? That doesn't mean that if you're applying for another component that you wouldn't leverage healthcare and housing. That's a big part of what this NOFO is about. So we just wanted to get an idea as, again, we're developing the plan of what sounds realistic. Like already we're seeing about 56% people have said that they might be able to leverage home art. So that sounds like it would be a stronger strategy for our CoC than, say, HUD 811 vouchers, which is only a 6% response. Second question is similar. Which of the following healthcare resources do you think you might be able to leverage for your project? Looks like substance abuse disorder treatment services is at 53%. Oh, local mental health authority up to, wow, 72%. 13 of you, oh, now 15 of you have said that might be a possibility. And contrast that with, say, public or private mental health care providers, which right now only 4 people think that they might be able to leverage that opportunity. The third question, as you can see, is what is the most important thing we can do to reduce unsheltered homelessness? As you know, across 215 counties, there's a lot of variety about what might work in one community over another. But the way the CoC plan is designed is it needs to cover the entire CoC. So we're kind of going for what is the majority. So not that it would for sure be the most important thing in your community, but the biggest thing that needs to happen across all our communities in general. So wow, creating more permanent supportive housing units. Got 18 responses. The others got fewer, but some didn't get. Well, you can put in other if you think there's something else that's more important. But it's clear, like how the NOFO is designed, really looking at getting those permanent solutions for people. And then this fourth question, what's the most important thing we can do to reduce unsheltered homelessness? So thank you. Oh, that's where you're putting your other. Thank you. I see that now. So just a smattering of rural healthcare in West Texas is rough, and we don't have permanent supportive housing or transitional housing. A team approach that includes the city and the county. Yes, those are significant partners. I will tell you, we did send an invitation for this webinar to all of the city and county governments that receive certain pools of funding from HUD under a consolidated plan. And so I did see some of those folks are joining us today. More affordable housing units and incentives for landlords to work with clients who may have backgrounds or lack credit or financial history. Absolutely. Anyway, thank you all for such specific feedback. We will definitely read it all and incorporate it into the plan. Craig, I think let's go to the next set of poll questions.
Got it. Give me just a second.
Oh, and I see people are putting some things in the chat. Like,
yeah, you can only do one other at a time.
Okay. Some of us have health navigator programs that could be valuable partners. Absolutely. Thank you for that input. We will make that a strategy as well.
So, Mary, this is unrelated to the poll questions, but there's been a couple of questions about leveraging PHA resources. So part of the notice, and John caught this, is that PHAs, as part of this announcement, PHAs were allocated about $47 million nationally to implement what they're calling stability vouchers, which are a type of incremental vouchers that PHAs will be encouraged or potentially required to coordinate with the continuum of care. It's possible that they may be required to accept referrals through coordinated entry. So, while we don't know the full list of those public housing authorities, we would, as soon as that notice is released, we can make that available so folks can get an idea about whether or not their housing authority was invited to apply. I do believe it's an application process. I don't think it works the same way as EHB, where they're just going to be, invited to administer. I think that there is a process by which they're going to have to apply. So that may be a possibility. I know also that there are communities in the balance of state right now that are pairing, for example, mainstream vouchers with coordinated entry, or set-asides under the mainstream voucher program to support households in permanent supportive housing. So I think the possibilities are there. Now, whether or not your public housing authority is going to be interested in that, that's a whole other question. I will tell you that from the CoC kind of like scoping out, we've been working pretty closely with TDHCA over the last year on their emergency housing voucher program. And so if TDHCA is awarded incremental or stability vouchers, we are 100% going to be pressuring them to partner with us in some meaningful way. So it is, I think like all of this has kind of led up to, at this point, it's going to be a team approach. Thank you, Mary. TDHCA is the Texas Department of Housing and Community Affairs. The other question that was in the chat that I wanted to address really quickly is this idea, it was kind of a project design question and who you can target with these funds. So youth aging out of foster care may or may not be eligible. Typically, they would be eligible if they meet the category 1, 2, or 4 definition under the HUD definition of homelessness. The tricky one is going to be those folks that are in sober living. So if folks are in sober living and it's not that transitional housing or whatever is not targeted to people experiencing homelessness and they've been there for more than 90 days, it's questionable about whether or not they would qualify for the program on like in terms of a program design, like designing a program around those households. So we'd really encourage y'all to look at the NOFO. Send questions to us, txboscoc@thn.org. There's a ton more content. So I'm going to stop talking right now and turn it back over to Mary so we can keep moving on these poll questions. And I appreciate y'all. Please keep them coming.
All right. Thank you all for going ahead and continuing to just answer the poll questions. You'll see we're asking about, do you have a street outreach strategy? Does it include reaching what HUD defines as underserved or describes as underserved communities, or people who are not served by the homeless system or homeless services system at the same rate that they're experiencing homelessness? So sometimes we refer to this as disproportionality. Do you currently provide immediate access to low barrier shelter and temporary housing? Those of you who said yes, we would love to hear how you're doing that. And especially those of you who said if you provide immediate access to low barrier permanent housing, either rapid rehousing or permanent supportive housing, those of you who said yes, I'm guessing it's because you have funding to do that. So great. Would changes to your community's coordinated entry prioritization strategies contribute to reducing unsheltered homelessness within your community? We will be talking about CE prioritization or coordinated entry prioritization. And then, are you taking any steps to ensure that people who are unsheltered or have histories of unsheltered homelessness are able to access housing and other resources in the community, such as steps to increase identifying, providing housing navigation services, providing access to healthcare and other supportive services? A resounding 25 people, or 100%, said yes. Oh, and 1 no. Okay. We know not everybody's a yes in that, and that's okay. That's how we know where we can target our efforts to help. All right.
Are you ready for the last ones?
Oh, I'm sorry. I thought that was the last one. Yes, let's move to the last ones. Do we have 2 more?
3, I think. We went up to 12 in this section.
Okay. Almost through. But this feedback will definitely give us a lot more information as we're starting to draft the plan. Courtney made a good clarification. Providing immediate access to shelter and temporary housing, yes, if available, but we've been at capacity lately, even with increased resources during inclement weather. And I think you're not alone in that. Lots of at capacity. All right, final questions. Do you currently involve people with lived experience of unsheltered homelessness in the delivery of services? For example, by hiring people with lived experience of unsheltered homelessness. Do you currently involve people with lived experience of unsheltered homelessness? Oh, that's the same question. In the delivery of services.
No, Mary, it's how do you involve people with lived experience?
Okay.
Yep.
Thank you. If yes, then how? Okay.
Yeah, it's a long one. So.
And then, do people with lived experience of unsheltered homelessness have voting authority on policies and priorities that impact people experiencing homelessness in your organization or in your community? So you'll see that over time, HUD has moved away from only asking about people experiencing homelessness participating in our efforts to now very specifically asking with people with experience of unsheltered homelessness, because that's been such a growing group. And then finally, do you currently outreach populations in your community? Do outreach to populations in your community that are underserved? That is, they haven't been served by the homeless system. That sounds similar to another question, but I may not be catching the nuance there. All right, I'm seeing some ways that you involve people. Some of our staff has experience living with homelessness. Street outreach and permanent supportive housing have hired people with lived experience as case managers. We just hired 3 in April. We have peer facilitator positions, temporary employment, hiring, serving on committees. Great. So lots of ways that you're getting people involved. All right. We are at the point in our presentation where we want to, we had talked about doing Q&A, but we'd also talked about giving people a break. Jim, I want to see what your thoughts are, since we are a little bit over our break time and we didn't actually do a Q&A from the audience in and of itself, although we've been answering questions as we go along.
Yeah, I would just kind of do a straw poll of the chat. We have a lot more content to go over. We're going to talk about the competitive processes and get into more detail on eligible activities in the second hour. If folks feel like we should keep going, we can keep going. Otherwise, we can just take a short break. I'm seeing one keep going. I like that. Short break. Okay, now we got a room divided. 10 minutes. We don't have time for a 10-minute break, Kelly, unfortunately. Let's take a 5-minute break and we'll come back in just a moment, y'all. All right, y'all, welcome back. I'm just taking a quick look at the chat pod to see if there are outstanding questions from before we went out on our short break. Jessica, I see I want information on using mainstream vouchers and rapid rehousing or coordinated entry in vouchers. Jessica, I can definitely follow up with you. I will say that the mainstream vouchers are paired with permanent supportive housing in the instance that I'm aware of, and that is in both Lubbock and, just Lubbock. But there are other instances of PHAs filling spots via coordinated entry in Odessa. And I'm not sure if anyone from those communities is on the call, but we can definitely talk more about it. CE causing bottlenecks, 100%. We recognize that CE is a challenge, especially in more rural communities and even in communities where it's been operational for a while. So Amanda, it's important to mention while it's extremely important to increase funding for capacity and access to resources, it's also important to identify funding needs and solutions for access to the housing. Once a person receives CE, gets connected to Rapid or PSH, then connects to housing navigation, there's a whole new set of barriers due to current housing market. Lack of affordable housing, but also increased restrictions from property managers, such as high income requirements, no flexibility, or evictions on criminal history. You are 100% right, Amanda, and I see a bunch of folks agreeing with you. The housing market we're in a historical kind of place in the United States in a number of ways, and definitely not all of them good. And so I think you're absolutely right. I mean, that's the challenge before us, is figuring out how to get folks into units. I know that again, dedicated housing navigation and landlord outreach and incentives have helped us with the EHV program, but not everyone has access to those types of resources, and so that is going to be challenging. So I want to move us into the content that we need to get through, and then we'll hopefully have time for some Q&A, like general Q&A after this presentation is done. Folks should be able to see a slide that says the competitive application process with a couple of points that we've already kind of addressed. One, the timelines, right? And so if the deadline for the NOFO is October the 20th, but the NOFO requires that the CoC set a deadline for project applications no sooner than 30 days before the application due date, and the CoC plan won't be done until late August, I think folks can kind of start putting together where the competitive application process fits in for the supplemental NOFO. We are planning to release the RFP for the supplemental NOFO in late August. We want to give folks as much time as possible, but it's almost, it would be in many ways unfair to ask applicants to commit to aligning with a CoC plan without actually having the CoC plan in front of them. So for that reason, we are delaying the release of the RFP. We hope that it's going to be enough time. We think that it will. There's going to be some resources in this slide deck to talk about how you can start preparing for the competitive process, both for the supplemental NOFO and then where appropriate for the annual NOFO. The annual NOFO has yet to be announced. As I previously mentioned, it is anticipated that it will have a due date prior to October the 20th. If you've been following along, typically HUD gives about 90 days for the annual competitive application process, and their fiscal year ends on September 30th, which is kind of an unofficial benchmark for HUD. They really try to get the competitive application process completed before September the 30th. However, they do not always achieve that goal. In 2021, the annual competition closed on November the 16th, so just a week before Thanksgiving. So they were way off the mark last year. But their goal is to have the annual process completed prior to the end of the federal fiscal year, which is September 30th. Similar deadlines that exist in the supplemental NOFO around application timelines will exist in the annual notice of funding opportunity. So I would be on the lookout for RFP for the annual competition pretty quickly after that NOFO is released. And so with that, I'm just going to move myself along here. So as previously kind of mentioned, we are planning to release a request for proposals. That RFP solicitation will contain solicitations for both the unsheltered set aside and the rural set aside. The RFP for the annual competition will contain solicitations for renewal project applications and, if offered, domestic violence bonus funding applications. And THN or the CoC may solicit applications for CoC bonus funding. Both application or both requests for proposals must be approved by the CoC board before they can be released to the general public. But due to the constraints around staff capacity and applicant capacity, we, again, as previously mentioned, may impose some restrictions on the CoC bonus funding and other restrictions within the project applications under the Unsheltered and Rural set aside. And we'll talk a little bit more about that in just a second. I wanted to talk with y'all about the process, right? Because even though the application timelines are on a different process, or on a different timeline, the process itself will follow more or less the same kind of path, right? So you can see it on the screen here. Typically, our applications will include the following items: the intent to apply. So that intent to apply, we'll talk a little bit more about that, but that's where folks register their interest in participating in this process and kind of right sizes THN staff response to that particular opportunity. The full application is where the bulk of the information that we gather from applicants is contained. There's some information in the intent to apply about the project application, things that you'll want to communicate, like an executive summary of the project, a proposed budget. Those types of like really basic project details will be included in the intent to apply. The full application is where we'll really dig into how will you promote safety for survivors of domestic violence if you're applying under the DV bonus, or how will this project, for example, under the rural set aside, expand access to street outreach and permanent housing for people that are living unsheltered. It's a deep dive into the project, both in terms of the applicant's capacity, the applicant's experience, and then the project and the project design. Typically, the application materials are collected via short answer or narrative responses, and include more than just narrative responses. The full application includes a variety of content that we're going to go into more detail here in just a moment. But just know that all of these processes that we're talking about will include these steps. Following the full application, we'll be looking at something called threshold and quality review. You can probably imagine what threshold and quality review is. It's where we're reviewing applications to make sure that they're complete, that there are no kind of structural issues with the application that would prevent them from going to award, and reviewing them for consistency and quality, and then moving them on to the independent review team. The independent review team is responsible for the scoring of project applications. So that responsibility lies outside of the Texas Homeless Network. We'll talk a little bit more about the independent review team, and if you're not going to apply for this opportunity, how you might still be able to participate. And then, of course, following the independent review team's scoring of the project applications, they will move on to ranking by the THN staff. So that's where we take the scores generated by the independent review team and compile a list of scenarios for the continuum of care board. And then finally, the continuum of care board will select one of those scenarios, and that scenario selection then becomes our priority listing. Now, we're gonna go into a little bit more detail on all this stuff, but I just want to see if the pace on where we're at right now, if folks are still with me. 1, 2 slow, 5 slow down. I'm seeing a couple of 3s. That's great. All right, cool. I'm going to keep going.
Jim, somebody asked, who picks the IRT?
That's a great question. So the IRT, there's an application process for the independent review team. And the application process is reviewed by THN and selected by THN staff. The requirements to participate in the independent review team are that the person live or work in the balance of state, and preference is given to folks that both live and work in the balance of state. Further, preference is given to folks in direct service in homeless services, and finally, the first priority is people with lived experience or lived expertise of homelessness. So we're really, with the IRT, looking for folks that have a deep connection to the work and are interested in giving back to the continuum of care in that way. We'll talk a little bit more about the IRT here in just a minute. I'd already mentioned that the intent to apply is how we right size our staff response. What I didn't mention is that applicants will only gain access to the full application at the close of the intent to apply stage of that application process and following an initial eligibility review. So applicants under any of these opportunities that we're talking about will need to submit an intent to apply, including renewal applicants under the annual competitive application process. So if those folks are on the call today and you're on the 2022 grant inventory worksheet, you will need to submit an intent to apply whenever we open that process a little bit later on this summer. If you are watching this webinar today on July the 13th, the intent to apply is yet to be released for any of these opportunities. And again, the intent to apply is really just to give us some preliminary information about the proposed project that THN staff used to finalize the full application and direct the questions that applicants will see. We moved in 2021 to an all digital process. I guess it's always kind of been all digital, but we moved to a platform, a grant management software platform. So it's different than it used to be, where we just did everything via email and Excel spreadsheets. Now it's a really kind of customized response. It's pretty cool. So the full application stage, I mentioned that the narratives are not the entirety of the full application. The supplemental narratives include details about the agency capacity and the experience with the proposed activities, the need for the project, the alignment with the coordinated plan or the CoC plan that we've been talking about today, letters of support from partners, local homeless coalition support, local partner support, housing or healthcare resource leveraging. In addition, we ask information about the monitoring history of the applicant. So whether or not the applicant has been monitored by TDHCA or HUD or their own financial audits, and whether or not there were any findings associated with those monitorings. And if there's a document upload that we want to know more if there's findings before we recommend you to HUD. And then in addition, there are steps 3 and 4 are eSNAPS steps. So eSNAPS is the platform that HUD uses to apply, award, and track their homelessness assistance grants over time. So in addition to applying to THN, applicants under any of these opportunities will also need to simultaneously apply to to HUD and press submit on that application, and then upload that application to our application. Don't try to remember that right now. There will be more content about that whenever we get a little bit closer to the application being opened and the intent to apply webinar and all that sort of good thing. But just know that those are required uploads, and so that's so we can check these projects for consistency from what the information that THN has in your narratives and the information that HUD's getting in their application. In addition, all applications must be consistent with the consolidated plan for that geography. So the certificate of consistency with the consolidated plan is where the consolidated planning jurisdiction for your community certifies that your project is compliant with their plan to address homelessness. I will say that there are, I believe at my last count, there were 40 consolidated planning jurisdictions in the balance of state. So it's not a guarantee that your community is covered under a local consolidated planning jurisdiction. Many communities are under this TDHCA or State of Texas Consolidated Planning jurisdiction. And there will be much more details about that, both in the RFP and in the intent to apply. Just know that it is a requirement that you have a certification on and that it's submitted with your application and to that your project is consistent with that plan. And then a little bit different from years past, we are asking folks for a detailed summary of the proposed matching funds, sources, and where necessary, third-party documentation. I'm going to go into that a little bit more here in a bit. CoC program funds, the Supplemental NOFO is no exception, is required to match at 25%. So if you apply for $1 million under the Unsheltered set-aside, you will need $250,000 of matching funds to support those $1 million of HUD funds. Matching funds can be either in cash or in kind. Again, we're going to talk a little bit more about that here in a minute because I think it's really important for applicants to understand as they're moving forward. So that's a full application stage. Again, I mentioned the threshold and quality review. Threshold and quality review are where THN staff review applications for completeness, make determinations about eligibility of the proposed activities, compare the applicant to the threshold criteria and the NOFO, and any additional threshold criteria established by the RFP. For example, there may be limitations on the amount of funding under certain budget line items that can be requested, or ratios between budget line items. So, for example, if you're requesting, and this is definitely not an official statement, as an example, but if you're requesting $100,000 in rental assistance, your supportive service request must be less than X dollar amount, right? So there may be additional threshold criteria in the RFP. Applicants are highly, highly, highly encouraged to pay really close attention to the request for proposals this year. The other threshold requirement that is a kind of a non-negotiable is SAM registration. So SAM registration is a system for award management. The system for award management is what HUD uses to track the folks that they're awarding, to make sure that you don't have any delinquent federal debt, to make sure that you're not doing business with anyone that has been disbarred from doing business with the federal government, or that you're on any do not contract list. I will say that in the time that I've been at THN, I've never encountered anyone that's been on any of those lists. Nevertheless, the requirement that the applicant must have a SAM registration in effect at the time of application exists. And so that's kind of one of those hard stop type things. And one of the things that we're looking at in the threshold review. In addition, I kind of mentioned it, delinquent federal debt, budget or activity requests that don't follow the guidelines in the RFP. If the applicant erroneously applied under the rural set aside in their eSNAPS application, but the unsheltered set aside in the THN application, that's going to be a threshold issue that would prevent someone from moving forward. Again, highly, highly, highly encourage folks to review the RFP and ask questions of THN staff. There will be a number of opportunities during the process to ask questions to make sure you're kind of pointed in the right direction, because this is a complex process. Any type of major technical errors, like I just described, could result in an applicant being determined ineligible at threshold. The second stage in that review process, as I kind of mentioned, looks at quality, consistency, and checks for errors within submitted documents. Items flagged for correction in that quality review process must be corrected in the time frame that's given in the RFP. So an example of a content error, an example would be a content error on the certificate of consistency. Let's say that the project name in the certificate of consistency is spelled differently or is in a different order of words than the project application in eSnaps. You would either be asked to correct the certificate of consistency or correct the project application name in eSnaps, but there must be continuity throughout the application package. Again, this is where we'll be looking at budgets and making additional determinations about the allowability or appropriateness of given requests, and may return applications that do not satisfy quality review requirements. Applications that are not corrected in the time frame given will not, unfortunately, pass to the next step in the application process. And I think that typically, the time that's given is about 72 hours to correct errors. Generally, the errors are pretty minor. They're consistency errors. There's a lot of really complicated charts. If you're an applicant from 2021, you probably remember us going back and forth about charts in the eSnaps project applications, regardless of how you applied. Those charts are super confusing. The best friend in this process is going to be the HUD detailed instructions. That's typically where we find most of the quality review issues, is in the eSnaps applicant profile and project applications. So again, we're going to talk more about this competitive process as these opportunities get a little bit closer. I just wanted to kind of bring folks along for the ride in terms of what to expect. So the independent review team, there was a question in the chat about the independent review team. I think someone asked whether or not a current applicant can apply under and participate in the independent review team. And if you are applying, that would categorically exclude you from participating in the independent review team. There can be no apparent or perceived conflicts of interest. All members of the independent review team must sign a conflict of interest statement and disclosure that identifies all of the organizations in this sector that they're a part of, whether those organizations are applicants or not. So I sit on the board of a local nonprofit, I would have to disclose that. If I am a consultant for X firm, I'd have to disclose that. The member must also not be a THN staff person or former staff person. I'll tell you that we haven't had any former staff persons apply to be on the IRT, at least in the last few years. But the idea is that we want to avoid any perception of conflict of interest with the independent review team. The independent review team will review those applications. They are connected to what we call the IRT coordinator, or the independent review team coordinator. That coordinator actually is their point person at THN, so they will work with them on training around the independent review team process, training around the SurveyMonkey Apply platform, navigating project applications, answering questions about the applications themselves, and providing general support to the independent review team. The process for the review generally will take place between 10 and 14 days. This year it's going to be pretty abbreviated, so I'm not sure what just happened there. Oh, I think I clicked on the independent review team interest form. Sorry about that, y'all. It's going to be kind of abbreviated. We're going to have to move really quickly to get all of this content through the local process and to what HUD calls the priority listing. So it's probably going to be on the shorter end of that window this year, at least for the supplemental project narratives. Trying to think if there's anything else I wanted to share about the independent review team. And folks, if there's questions in the, please feel free to drop them in the chat. Oh, that's what it was. So the independent review team will review all new project applications. New project applications under the Supplemental NOFO, both rural and unsheltered set-asides, and the Annual NOFO under the DV bonus, or if offered, the CoC bonus. Renewal projects under the Annual Notice of Funding Opportunity are assessed using an HMIS and comparable database scorecard that is performance-oriented, as well as external factors such as monitoring history, timeliness of uploads to the Federal Audit Clearinghouse, engagement of people with lived experience, and their efforts and organizational policies around race equity. The renewal project scorecard, as well as the full application scorecards, will be an attachment to the RFP for all to see before you go through the application process, and for you to look at and evaluate before you submit your applications. The ranking and board approval is the next step in the process. Ranking and board approval occurs pretty quickly. It is actually my favorite part of the process, because it's where, one, it means we're almost done, but two, it's where I get to use the math skills that I never thought I would in high school. And so that looks generally like THN staff taking the results of the independent review team, assembling a list of scenarios. Sorry, I was looking at the chat. Yeah, that's correct, Mary. The scorecards will show exactly what the scoring criteria and point values are. That is correct. We'll get a list of scenarios, compile, get the list of applications, compile them into about 4 scenarios per opportunity. And the factors that influence the ranking scenarios presented to the board include raw application score, the relative need for one type of intervention over another, and then the mathematical advantage of a particular scenario over another. So typically we're doing one priority listing. The supplemental NOFO is a little bit of a wild card. And the reason that is a wild card is because there will be at least one additional priority listing for the supplemental NOFO. But until the detailed instructions come out, we really won't know for sure whether or not there will be 2 priority listings within the supplemental NOFO, one for unsheltered and one for rural. I think they will probably assess them separately, given that the funds are set aside separately, but there may be duplicative ranked orders in the unsheltered and rural set aside priority listings. So that will be kind of interesting, and we'll know more when the HUD releases the detailed instructions. Again, I just want to share kind of some general information about the supplemental NOFO. Applicants will likely be limited to 1 new project application under either set aside. You, again, must be registered for the system for award management. There is a 25% matching requirement. The other nuance with the supplemental NOFO is this idea of quarterly reporting. So if you're a current ESG recipient or subrecipient of the state or a city county, you are probably familiar with quarterly reporting. They're implementing a similar process for the CoC program specific to the supplemental NOFO. So each of these projects that are awarded will have a total of five reports annually. Recipients and applicants must have an accounting system compliant with 2 CFR 200. You'll contract directly with the U.S. Department of Housing and Urban Development, but THN will play a supporting role throughout the life of the project. We engage recipients around technical assistance, monitoring, and general support throughout the life of their project. And so, this is not just like you apply to us and get the funding and then you go off and do your thing and we'll check in with you in 3 years. There will be frequent communication between THN and the recipients of these funds to make sure that we're all kind of moving in the same direction and implementing this CoC plan the way that the way that we told HUD that we would. So applicants must leverage housing or healthcare resources through firm written commitments, and applications must align with the coordinated plan to address individuals and families. And I think this one should go without saying, but all projects must be administered in fidelity to Housing First. I'm just looking at the time here, so I'm going to pick it up a little bit, y'all. We have a little bit more content to get through. This is a chart of the eligible activities under the unsheltered and under the rural set-aside. The unsheltered set-aside funds all of the things that you are familiar with seeing if you've done this process before, but if not, they'll fund PSH, which is the non-time limited, rapid rehousing, which is the time limited intervention, joint THRRH, or joint transitional housing and rapid rehousing, which is also a time limited intervention. Again, the HMIS lead can apply for HMIS if you're applying under permanent supportive housing or any of the component types. HMIS is a budget line item, not a component. So you can still request funding for HMIS. You just can't request an HMIS project, if that makes sense. And then new is HUD's bringing back the SSO project. So the SSO could look like street outreach. It could look like a street outreach coordinated entry program. But all of these follow the same kind of logic, in that the eligible participants in those programs are people experiencing homelessness under Category 1 and 4 of the homeless definition. The rural set aside is a real wild card. They will fund all of the things that the unsheltered will set aside will, in addition to additional eligible activities established by the NOFO. So if folks are 2 months or more behind on their rent or utilities, the recipient can pay rental or utility arrears up to 6 months. The recipient can pay up to, short-term emergency lodging for participants in any of the component types. Recipients can, or applicants can, request funding for repairs to make housing habitable up to $10,000 per unit. Capacity building activities. So HUD has allowed applicants to request up to 20% of the subtotal of their award in capacity building. So what that would look like is, if you're using that $100,000 example, if you're applied for $100,000 total budget before match and admin, you could request an additional $20,000 in capacity building to be used in a variety of ways, but one is for staff retention and professional development of staff in the project. That activity and all of the activities that I'm talking about right now are only eligible to applicants under the rural set aside. The other activities are emergency food and clothing assistance, which is not generally eligible, and then costs for making use of federal inventory property programs. Supportive services are eligible under all of the opportunities and all of the components. Specifically, that holistic case management is kind of what we would generally look for as a minimum in terms of supportive services. We would really look for recipients and applicants to leverage partnerships. And so rental and utility arrears have to be for people enrolled in the project, John, if I'm understanding your question correctly. So potentially, depending on the project, if you applied for an SSO project and you're doing street outreach, you could use rental or utility arrears for folks in your street outreach project. It's really quite fascinating. They've broken all the rules. I feel like I say that every year. They break all the rules. Every year they make some rules and then they break them, and then they make a few more rules and they break those. And so I don't even know what's happening anymore. But yes, there is that degree of flexibility. HUD definitely keeps us on our toes. That's awesome. I mean, I hope that doesn't sound critical. It's a great flexibility that we're being offered under this opportunity. So the annual NOFO, all of the same things apply to the supplemental NOFO, with the exception of the reporting. So you're only doing annual reporting as opposed to that, quarterly plus annual reporting. All of the other things stay the same, more or less. The CoC may limit the types of assistance that can be requested and by whom. And so that may look like DB bonus only, restricting budget line items. There's a variety of ways that COCs can prioritize their resources to make the most out of this opportunity. The annual NOFO eligible components that we believe will be in the annual competition are DB bonus and COC bonus. Again, the COC may limit the total request and limit requests by component and activity through the RFP, but all of the activities are eligible under the unsheltered set aside, with the exception of supportive services only. The only eligible SSO project under the annual competition, as far as we know right now, will be an SSO CE, or a supportive services only / coordinated entry project. So if you're going to be doing coordinated entry as a component of your street outreach, you would not request it under SSO CE under the supplemental NOFO. You would request it under SSO. Highly encourage applicants to watch the HUD webinars that were released and posted on the HUD on HUD.gov, because the folks that wrote this NOFO will go into great detail on what you can and cannot do with these funds. It's really, really helpful. So I think the elephant in the room is this alignment with the coordinated plan, right, for the supplemental NOFO. It's a really challenging component of the process this year. It has not existed in the same way in years past. And applicants don't have to wait for that draft plan to be done or the plan to be finalized before you can start making plans for your project applications. Applicants will definitely need to consider the factors that ultimately end up in the plan. But some things that we would recommend that you think about when evaluating any of these opportunities are, what need is this project addressing? Would the larger community agree that this project with this design and this target population is the highest priority for the community? How does this need align with the CoC strategic plan and the 2020 gaps analysis that looks at housing by region? How does this project align with HUD's policy priorities? What role do people with lived expertise play in the design and implementation of the project? And how will racial disparities be reduced as a result of this program or this project? And are you targeting people living in unsheltered homelessness? And if not, why? Is there a greater need in your community? Do you have the data to support that and a logical justification? And then how will this funding, if you're targeting another population or if you're targeting unsheltered homelessness, how will this funding contribute to a reduction in unsheltered homelessness in your community? I have a quote from Norm Suchar, who's the director of the SNAP's office in Washington, D.C., who said in their kickoff webinar, ultimately, it all boils down to how you will structure resources awarded under this special NOFO in a way that will contribute to reducing unsheltered homelessness. So I would just let that sit for a second, right? This is not this is going to be a really competitive process, both locally and annually. And Courtney, these are kind of rhetorical at this point, because I don't even know how I would answer those questions right this moment. But I think these are really good things for folks to be thinking about as we're going into competition season. In addition, how are you leveraging housing resources? We talked a little bit about these special purpose vouchers or stability vouchers that will be potentially be awarded to housing authorities in your area. How will you leverage those? How will you leverage mainstream if possible? We'll be looking for a letter of commitment from that PHA. And a date that the commitment will be available, right? So it's not just like, oh yeah, we're going to work with X organization to develop a prioritization. HUD wants to know a plan, and so do we. But the other thing that we would encourage folks to consider is your current strategy for recruiting landlords and units for tenant-based rental assistance. That is a really important aspect of all this, as someone alluded to earlier, right? The housing market is really, really tight. So landlord recruitment, engagement, and maintenance is arguably one of the more important things that an organization engaged in this type of work can be doing right now. Additionally, alignment with healthcare resources is really important. We want to know how applicants are leveraging outpatient health services, outpatient substance abuse treatment services. All of these services that I'm mentioning must be voluntary, but the idea here is that they're made available for the benefit of people in your proposed project. The date of the written commitment must include the projected value of the commitment and the dates the resources will be available, which should align with your project application. Going back to the leveraging housing, I want to make it really clear, applicants cannot leverage shelter beds, transitional housing, or other non-permanent housing interventions and receive credit for leveraging housing through this NOFO. Commitments from PHAs, I would say, are probably going to be your gold standard for demonstrating this requirement, but it's not the only option, right? If you have a nonprofit housing developer, if you have another, there's affordable housing in your community that you know that you can partner with for this purpose. There's a variety of ways that you can meet this criteria without your PHA. But I would say that, definitely PHAs are encouraged.
Hey, Jim, I got a couple questions that came in.
No. Yeah, okay.
Kelly missed what you said about the number of applications required if we apply for more than one category in unsheltered.
Yeah, that's a great question. So there's two questions. I see Doris is, it's for one application per applicant. So there's not one total application for the whole thing. There's one application per applicant under the Unsheltered, Rural, or CoC or DV bonus, if that makes sense. So basically what we're saying is we're asking y'all to pick where your organization and your resources and your expertise fits best under the unsheltered or the rural. We want to desperately avoid a situation where someone applies under both and gets awarded under both, and then all of a sudden they figure out that they have to get two of these massive projects off the ground, and they stumble and fall at the technical submission or an implementation. So Kelly asked the number of applications required if we apply for more than one category in unsheltered. So that's a great question, Kelly. So you wouldn't apply for multiple categories. I'm just going to go back to that because I think that's a really important question. So if you can apply for permanent supportive housing or rapid rehousing. You could not apply for permanent supportive housing and rapid rehousing in one project application. And what we're saying is that you would need to make a choice between rapid rehousing and permanent supportive housing in order for your project application. Now, the supportive services, the HMIS, like all of the other things that go along with CoC program funding, typically it's mainly just supportive services, do not require a separate project application. The additional eligible activities under the rural NOFO can be combined with any of the rural set-aside eligible components. We're getting into like some weird technical area, but there's a difference between activities and component level. So the things above the activities are component level costs, if you will. The activities are eligible under any of those components. I feel like I just confused everyone really, really hard. Okay, you cannot. Yeah. Yes, that is correct. You cannot apply for both PSH and rapid rehousing in the same application. That is correct, Mike. Leasing expenditures are still excluded from match. Is that correct? That is correct. It is unclear whether or not HUD will allow for leasing costs, although they're not expressly prohibited in the NOFO. They may be excluded from the detailed instructions. I don't know. It will all just kind of depend on what the detailed instructions look like before I could say that one for sure. But yes, leasing expenditures are still excluded from match. Mike asked, is there a reason? The reason that you can't apply for both rapid and PSH in the same app, that's a HUD restriction. You can't combine those activities. You can't combine components within a single application. You can only combine a component with the activities. Typically, the activities are included under the component, but with the supplemental NOFO, they included these additional activities, in addition to the activities that are already included under the component. Y'all, I just opened a can of worms, and I'm so sorry. We were going to try to do a couple of poll questions, and that actually was the last slide that I was on before we kind of went back to the eligible activities. If you have questions, and I would anticipate that most people on this call do, please email txboscoc@thn.org. We have multiple staff monitoring that email box, and we will respond to you as quickly as possible. I would highly encourage folks to watch the webinars. Craig, you can go ahead and open those polls. Highly encourage folks to watch HUD's webinars about the supplemental NOFO. And then to wrap this up, if we were going to open both competitions today, do you know for sure that your organization would apply? Yes, no, or unsure. If you would apply, would you apply under the supplemental unsheltered, supplemental rural, annual DV bonus, annual CoC bonus? And then additionally, do you know which component you would apply for? It says component/activities. The only caveat to there is that, if you're under the rural set aside, you get the additional activities. If you're under the unsheltered, you're not eligible for those additional activities. And then finally, we really want to know that if you're not going to apply, and right now, like, I'm not going to do this, why not? What can we do to make this more appealing to you as a potential applicant? And we do have a couple more slides. If you're not going to apply and you want to participate in the IRT, you can actually complete the application to participate in the IRT by visiting the link in the PowerPoint. I saw the interest webinar or the interest link posted in the chat earlier. Both will work. And then additionally, some resources from HUD and NAEH or the National Alliance are here on slide 50. And then THN's website and the competition mailing list are on slide 51. I would highly encourage, if you're wanting to stay connected to this project, to this process over the next few months, to visit this competition email list. And I'm just going to go ahead and post it in the chat if it's not already there. I don't think that it is. Yep, I think that's it, John. Right? I think that's it. Exactly. I think we're looking for local coordination, collaboration. It cannot be one organization carrying folks. Definitely not on the unsheltered set aside. And the rural set aside, I think, is a great opportunity. And with the additional flexibilities, it still is going to be tough. But we're really looking for coordination and collaboration. So I don't know if I missed questions in the chat. I
think you skipped over Doris's. I think that's the only one we've missed.
I'm sorry, Doris. Let me get back to you here.
Do they understand that the CoC will only accept one new application under the supplemental NOFO?
Yeah. No, I hope I addressed that. But it's one application per organization or per applicant. So we're anticipating a number of applications recommended to HUD when the dust settles on this thing. And so no, I would say we're hoping to get as close as we can to the amount that they've allowed to be available to us. Hope that answers your question, Doris. Under capacity building is what I understand from William, but more will be in the detailed instructions and in the materials to come out. John. Dana says Erath County is interested in collaborating, but not as the lead. Fair enough. If you're in Erath County, I highly encourage you to reach out to Dana. It is 3:02, y'all. I want to be respectful of people's time. I appreciate you so much sitting through the volume of content that we threw at you today. I hope that you will join us for future community planning sessions around the community plan. We cannot do this without you. And I don't know, Mary, if there's anything else that you wanted to say to wrap this up, but again, just thank you so much.
Yeah, I just want to echo that. We've got people on the meeting today who are from so many different arenas. So we've already got a great group of collaborators going across our CoC. So we definitely appreciate you attending today, and please reach out with any questions or requests, and we will try to meet those, and we will be seeing you for NOFO land.
So if folks want, I mean, I can stick around for a few minutes. I see there's some more questions still coming in the chat. Geneva, when an emergency shelter is available, can an agency still utilize a hotel program to provide diversion or short-term housing until more stable housing is secured? Whew, that's a tough one. HUD makes it really clear that this is not intended to replace existing shelter capacity. It cannot create permanent shelter beds. So that's a little iffy. I definitely wouldn't base a program design around that. Yeah, so if the person is no longer, yeah, I feel like send a message to TXBOS CoC because I want to learn more about that situation. I think something that's really important to remember, Geneva, is with that, especially with any of the additional eligible activities under the rural set aside, is that first and foremost, these are permanent housing interventions, and HUD's goal is to move people quickly from emergency shelter or unsheltered homelessness to permanent housing, right? So I would really, I would think about that as y'all are developing your project design. I wouldn't put a whole lot of eggs in this as like a replacement for emergency shelter or even like a real major supplement to emergency shelter. They're going to have to be, the beds that you request, if you're requesting under the rural set aside, are going to have to be connected to project participants and participation in the program. So geez Louise, Jim. Hotel programs have kind of become extended stay beds for shelter, while the ES facility becomes truly ES, keeps rooms open for folks who need them in emergencies. Yeah, that's fair. Doris, please reach out. You're right, it is, especially if it's the first time that your name looks familiar, so I don't know if we've interacted before, but if this is the first time through the process, please reach out, and we will provide you with the resources that we have. But yeah, the process is daunting on both sides for sure. Okay, great. Are you in Beaumont or on the Gulf Coast somewhere? Am I remembering that correctly? Lamar. Yeah. Geneva, another good question. So can we use the CoC written standards as long as we make sure that the services we offer are listed? So that's a great question. The CoC written standards do not currently include THRRH. We were planning to update them this fall. I think we're going to be working on this primarily. But it's a little bit different from ESG in that your projects do have to be in compliance with the written standards. you don't have to maintain your own written standards. You will use the COCs in addition to project level policies and procedures. And, obviously your organization's financial internal controls and financial policies and procedures to administer the project. So, but yes, they do have to be in alignment with the continuum of care's written standards. So, for example, under rapid rehousing, and we did not discuss this today, but rapid rehousing is administered in a progressive engagement approach in the balance of state. So what that means is, we're not enrolling people in rapid rehousing and then saying to them, okay, you're going to get 12 months of rental assistance. We're offering people enrollment in rapid rehousing, and we're going to give them the amount of assistance that they need to stabilize and be successful in placement. And so that requires much more frequent assessment. I think the minimum is quarterly, but we find that many organizations assess the amount of assistance as often as monthly to ensure that folks are getting the resources that they need to stabilize. So, yeah, you do have to comply with the written standards, and there will be an opportunity for public comment to the written standards a little bit later this year. Yeah, absolutely. Thank you for asking. These are great questions. All right. I see Doris typing, so I'll hold on for a few more minutes. If there are no other questions, though. Yeah, thank you, Doris. Have a great day. Thanks for attending. And thanks, everyone. Oh, Mary says we're still recruiting for 7 seats on the CoC board. So if anyone on the call wants to participate on the CoC board, please reach out to Mary. Francis, Mary might be the best person to answer that question in terms of the structure of the board, but Ellis County is eligible and is one of our counties. So if you live or work in Ellis County, you're eligible to run for a seat on the board. And I basically just said exactly what Mary typed in the chat. I think if you visit that hyperlink in the Mary's chat above, you'll see more information about the board. The seats are based on specialization. So if you're working with Ellis County as a governmental employee, you may be eligible for a certain seat, but I don't stay up to date on which open seats there are. Mary's probably like, what are you talking about right now? Oh, yeah, absolutely.
Yeah, we'd love to have you, Francis. A housing developer?
That's what I like to hear.
Yeah, that's great.
Yeah, that's awesome.
Yeah, I'm guessing you have talked with our coworker on our team, Jen Beardsley. She's our LHC coordinator. If you're the president of the Ellis County Coalition. Yes, we love Jen too. She's amazing.
I'm on your website right now, Francis. Looks pretty cool.
Yeah, so nice to meet you.
Well, if there are no other questions, we can shut it down. Great. Thank you so much, Francis. Glad you're here.
All right, everybody else, you'll have a good rest of your afternoon, and I'll be sending out the recording as soon as I can.
Thanks.
Thank
Greg.
you, everyone. Bye.
Bye.